Our founders could never have envisioned where the school has come, both clinically and on the research side, in that 125 years.
I am very proud of Pitt itself. I'm proud of the school and especially proud of the people here.
There's something that happens every day with patient interaction, student interaction, that brings you joy that you can't put a price tag on.
There's not a day you walk in the lab and it's the same as yesterday. You literally look forward to come to the lab and say, what's happening today? Because it's exciting.
Pitt Dental has contributed to dental education in so many ways and to dentistry in so many ways. Fluoride, one of our top 10 public health innovations, that you can trace its roots back here to Pitt Dental.
Decay was a huge public health problem and nobody knew what to do about it. And suddenly we had something that maybe could help. And so let's think about putting it in the water. And that idea came from Jerry Cox.
Pitt's been really on the forefront of dental anesthesia right from the beginning, and that's because of our founder, Dr. Leonard Monheim, established a department of dental anesthesiology here at Pitt in 1949.
At the same time, he started a residency program and would take sometimes 10 residents a year. He was training people that he called doers. They would take a year or two with him, then they would go into private practice or maybe take up another specialty like oral surgery.
Harry Archer was one of the most significant figures in the specialty of oral and maxillofacial surgery, and he was a fixture here for decades. The first residency in oral surgery anywhere was here at the VA hospital. His textbooks are legendary. He was the individual that lobbied the ADA that dentistry needed standards for training, both for its doctoral programs to become a dentist in the first place, and then also for specialty areas like oral surgery, periodontics, orthodontics, a number of other areas.
The Cleft Palate Center was, again, one of the first ones in the country here, and it was one of the oldest funded schools in the country.
So we went from knowing almost nothing about how clefts form to now having discovered about 50 different genes that contribute to the risk for those birth defects.
Those are really proud moments for us to know that Pittsburgh, the University of Pittsburgh, specifically Pitt Dental Medicine, they were the key trailblazers in those areas.
I've always liked teaching for some reason. Every day is exciting to me. It never gets old. You don't get burned out, and it's just a great way to practice dentistry.
I think the professors here are here to help the student, to get people to the next level. I think they get a personal satisfaction from helping a student gain competence, gain confidence in themselves to do things.
It was so easy to talk to all the faculty, kind of discuss things. They would always make time for me, not just the didactic faculty, but especially the clinical faculty.
All of the faculty members here are like, second family to me. I made really good friends here. All the staff is super supportive. So it was definitely, my expectations were met or exceeded here.
Knowing that you're having a positive effect on the profession, right? Knowing that what they learn here, our students will carry with them as graduates, for years to come in the profession in a positive way.
The ability to have all of the different specialties that are represented in one building in the school for our students to take advantage of learning from experts in their field. We have such amazing faculty who are able to teach our students from their own firsthand experiences.
And if you look into other schools, we know that they don't have, let's say, a perio graduate residency, or they may not have anesthesia. But when you're here, it's just so commonplace that you have this rotation in this department that you don't really think about it that much.
Just as nurses, dentists, physicians, dental hygiene is a service profession. It's a difficult program, but it's a very successful program. We've had 100% national board examinations for many years.
Another metric is how well our students do on their boards exams, and we're always up there. We always do very, very well on training our students. They get a really good clinical training when they come out, as well as a research background.
Pitt is a strong research institution, so it's really in our DNA, and it's as a university, as a school.
Research and innovation is everything to a university like ours. And I think this is the proving ground for the best ideas that are going to take us forward as a society, not even just as a profession in dentistry. So it's our obligation as a university to innovate and to engage in research that is for the public good.
We were able to increase the research at the school, which was very important to the university. Improving our research was a really essential part of what was done there.
When I arrived, the school was about 27th in NIH funding of all 50 dental schools around the country. Now, in the last 10 years, we've been in the top 10 or higher.
When you look at success, you can define success with how many publications you've done or grants or things. But I think the ultimate success would be how many patients we treated, or this therapy was developed at Pitt.
That is the field of regenerative medicine or craniofacial regeneration in our space. Dr. Charles Sphere is the head of that here. He's really the key mind behind building that team.
So now Pitt Dental School is completely at the forefront of research in both craniofacial regeneration and craniofacial and dental genetics. So we're known nationally and worldwide.
One of the research projects I've done in the last couple of years is a nasal spray, where we're going to spray a local anesthetic up your nose, and it's going to numb all your teeth from incisor back to premolar, so that you don't need an injection. That's kind of nice, you know.
So that's the whole emphasis of our research program, to do everything we can in our little corner of research, our little corner of the world, doing everything we can to improve the health of individuals around us.
I think Pitt is clear. The University of Pittsburgh has exceptional clarity about its mission as a school. I think it has exceptional clarity about its responsibility to the citizens of the Commonwealth of Pennsylvania.
So one of the very important things we do as a school of dental medicine that's really unique at the university for any school is interface with the public the way that we do. At Pitt, we're the clinic. We're the folks that take care of the public directly more than any other school.
One of course, the biggest attributes for us is the Center for Patients with Special Needs and the dental anesthesiology programs, which are so unique in and of themselves that really promote an opportunity for our students and our patients to receive care that maybe they wouldn't experience in other places.
Back when I was in school, most of the patients with special needs were institutionalized, and they had dental services provided in their institution. But that's all gone away. They've been mainstreamed, and they need dental services.
So we have a center here that addresses that need. It works to help be that safety net for those very complicated individuals that might have very complex behavioral needs or medical needs that really require that type of setting to provide very high-level dentistry, comprehensive care, and a number of other services for this group and these families that really have no other place to go. And it was the first center of this type at a dental school anywhere.
The intent with creating this center was to be sure that every graduating student, every dentist, would be comfortable and capable of dealing with special needs patients on some level.
It's just heartwarming to see what the services that the school offered, and the people that they offered it to.
Pitt Dental Medicine has been providing care for those with special health care needs as far back as the early 60s in different areas of the school. Now we are seen as the example for other dental schools.
One thing that they do very well is the Department of Pediatric Dentistry is a good safety net for patients that are on Medicaid insurance. A lot of dentists do not take Medicaid, but the dental school, Children's Hospital, they do.
I can't even imagine what it's going to be like in another 125 years, but I know that the school and the faculty will stay at the forefront of the innovations that are to come, and our two research strengths will be right there at the forefront.
I think the most important legacies of what Pitt Dental Medicine means to the community here, to the world broadly in the care space of dentistry, and to the profession, have to do with the development of the profession over time and what 125 years has afforded as an opportunity for Pittsburgh to make its mark in those spaces.
We already feel as though and we know we're one of the top-notch schools in this country. Where else can we go with more opportunity? Gosh, it's just so hard to say, and it's just going to be a wonderful thing to see.